Hello, my name is Grace Shimko, and I'm an oncology registered dietitian at Stanford Healthcare. I help support patients in all phases of their cancer treatment to ensure they remain nourished and help to manage symptoms and side effects through proper nutrition. Welcome to Class 4 of the Thrive class series, brought to you by the Department of Clinical Nutrition at Stanford Healthcare. This series of 6 classes are designed to help you understand your nutrition needs throughout treatment. Today's class is a general overview of nutrition and managing your weight during cancer treatment. Today, we will be discussing possible weight changes during cancer treatment, how to reduce these changes, and when it is important to contact your care team about weight issues. I will also be sharing several tips and ideas to help guide you when making nutrition choices. Weight changes are very common in cancer and its treatment. Due to the disease itself, treatment side effects, medicines, and diet and lifestyle changes, you may experience weight loss or weight gain. There are several reasons why your weight may change, including the cancer itself, cancer therapy, such as hormone therapy, bowel changes, such as constipation or diarrhea, and fluid changes in your body, such as lymphedema or water retention in your legs or other parts of your body. Weight fluctuations do not always mean you are gaining more fat on your body. They may be from the reasons just mentioned. Significant weight loss or gain can affect your chance of recovery. Weight management should be included in your treatment plan. It is important to closely monitor weight changes with your care team and work closely with a registered dietitian if you are experiencing either weight loss or weight gain. Weight loss can lead to more serious health problems, especially when going through cancer treatment. Weight loss is concerning when going through treatment for the following reasons. Eating less can mean the body may not get the calories, protein, and other nutrients it needs at a time when your body needs to be at its strongest to undergo treatment. You may be losing muscle that you need to stay strong during and after treatment. Muscle also helps you move, walk, and do everyday tasks, so it's very important. Chemotherapy is often dosed based on your weight, so if it changes, your dose may need to change. If you lose too much weight, you may need to stop treatment because of the risk of being malnourished and having lower amounts of vitamins, minerals, and protein. In some cases, losing too much weight can be life-threatening. Now I'm going to talk to you about unplanned weight loss during cancer treatment, the importance of not losing too much weight during treatment, and ideas on how to maintain your weight and gain weight if needed. Many people with cancer lose weight because of side effects related to surgery, chemotherapy, and radiation therapy. How you eat can change throughout your treatment. Nausea, vomiting, diarrhea, and constipation may cause you to have less of a desire to eat. It can also cause dehydration, which is not having enough fluids, and losing fluids can cause weight loss. Hunger and fullness cues may change during therapy. You may feel less hungry or you may feel more hungry. The location of your cancer may make it difficult to swallow. It can also cause pain in your stomach or intestines. You may develop mouth or throat sores that can make eating a painful and uncomfortable experience. Foods may taste different due to therapy. Foods that you like may become less pleasing. Some people report foods taste blander, have a metallic taste, or foods taste more sweet or salty. Feelings of depression or being very tired and sleeping often can also change eating habits and timing. Sometimes you may even feel too tired to chew, making it difficult to eat enough food to meet your needs. Also, cancer cells need energy to survive, so your body may burn more calories at rest than it normally would. The body also uses more calories due to stress to help repair damaged cells and tissue, to rebuild muscle, and to also fuel your healthy cells. Please contact your team right away if you experience sudden weight loss. Sudden weight loss is losing 3 pounds or more in 1 week or less. This may be a sign of something more serious. Also, contact your team if you feel tired, dizzy, weak, and not able to do your daily activities. You may have low blood sugar due to decreased food intake, or you could be dehydrated. Also, contact your team if you are not able to eat or drink your usual amount for more than 3 days. Also, contact your team if you have any other symptoms that are making you worried or concerned. Many patients, when they receive a cancer diagnosis, decide to restrict their diets in hopes of having a healthier lifestyle. You absolutely do not need to do this. There are no foods or drinks to eat or stay away from that will slow down or speed up the growth of your cancer. Unless your doctor tells you not to eat specific foods for medical reasons or you have a food allergy. Limiting or not eating certain foods will not change the course of your cancer. Unfortunately, we do not know how chemotherapy and radiation will affect you. That is why it's not a good idea to restrict your diet if treatment already cuts down on what you will want or be able to eat. For example, if you have a decreased appetite or feel full quickly, eating a salad or vegetables most likely will not sound appealing or be easy to eat. Other tips to help reduce risk of weight loss during treatment include setting an alarm to remind yourself to eat. You may not feel hungry, but you still need to eat. An alarm can be helpful to remind you to grab a snack or a protein shake. Also, instead of eating 3 large meals a day, try to have meals every 2 to 3 hours. Large meals may fill you up too much, and you may not feel hungry for the next meal. Small meals can be easier to consume. Put food in different places in your home as a reminder to eat, especially in areas where you spend a lot of time, such as the couch or your bedroom. Make sure the food doesn't need to be refrigerated. Some ideas include protein bars, granola bars, trail mix, dried fruit, nuts, seeds, crackers, cookies, dry cereal, muffins, pretzels, pudding, popcorn, potato chips, chocolate, applesauce, roasted chickpeas, and biscuits. Eat less high fiber foods, which are more filling. Eat more foods higher in protein and fat, which are higher in calories. For example, if you are eating a meal, leave the vegetables for last on your plate. Try to eat more of your fish, chicken, turkey, or other protein on your plate first. You may find you dislike certain textures and temperatures. If so, try different foods to see if it helps to increase your food intake. For example, some people find it helpful to eat soft foods if they become tired from chewing, or cold foods if they're feeling nauseous. Add more seasoning and herbs to your food to help improve taste. If you have mouth sores, be sure to avoid hot, spicy seasonings. If you experience taste changes, sometimes eating more bland foods can be helpful. Some ideas include fish, chicken, turkey, tofu, eggs, oatmeal, cream of wheat, polenta, potatoes, crackers, nut butters such as peanut butter, almond butter, soups, applesauce, custard, and pudding. It's important to keep food and meals simple. This helps to increase your food intake. Having on-the-go items will help ease your anxiety over what to eat or to prepare next. If you're cooking, make extra and freeze it for later. For example, if you are making chicken breasts, make several more than you will eat that day. That way you have some for later in the week. There are several meal delivery companies that will deliver already prepared meals to your home. All you need to do is microwave them. Don't hesitate to ask friends or family for help with meals. Tell them what you like to eat. Smoothies are also an easy way to get calories in. They are quick to make, and you can add foods such as nut butters, flax meal, avocado, MCT oil, condensed milk, protein powder, and even tofu for a high calorie option. Smoothies can also be an easy way to include more vegetables and fruits in your diet. There are many already made nutrition drinks and protein powders as well. You can purchase them at your local grocery store, drugstore, or online. These drinks can be an easy way for you to meet your calorie and protein needs with no preparation time. Every bite counts if you are not eating enough and losing weight during treatment. Increase calories and protein easily. You can include some of these foods in your diet to help maintain your weight. If you're having dairy, have full fat dairy instead of low fat or no fat options. Cream is also a great way to increase your calories. You can use it in your cereal or oatmeal instead of milk or water. Eat full fat cottage cheese and yogurt. If you can't tolerate lactose, have lactose-free dairy or plant-based dairy, such as soy, coconut, or nut milks, yogurt, ice cream, and cheese. Rather than having water, try to have more higher calorie fluids in your diet. This helps increase calories easily. Some patients find it helpful to add juice to their water. Have 4 ounces of juice and 4 ounces of water instead of just water. You can also drink electrolyte replacements such as Gatorade, Pedialyte, Drip Drop, or Liquid IV. For more calories in your soups, you can have soups that are cream-based instead of broth-based. If you don't like cream soups, you can add 2 tablespoons of olive or avocado oil to your soup. Bone broth is also very high in protein. You can use it in place of beef, chicken, or vegetable broth. Other foods to eat include the following: eggs, including the yolk, nuts and seeds, hot chocolate made with whipped cream and full-fat milk, popsicles, jello, pudding, custard, and grains. You can also add toppings to your food as a great and easy way to increase your calories of the food you're already eating. Here are some ideas: whipped cream, sour cream, cheese, cream cheese, butter, gravy, pesto, mayonnaise, chocolate syrup, honey, maple syrup, hummus, dips such as ranch or blue cheese, nut butters, seed butters, salad dressings, guacamole, oils such as olive, avocado, or MCT oil. Here are some additional tips. You can add extra olive or canola oil when cooking lean meats, vegetables, stir fries, or soups. You can have 1/4 to a half cup of nuts every day. You can use peanut butter or any other nut or seed butter on your sandwiches with fruit or on crackers. You can put hummus on pita bread or crackers. You can add guacamole or avocado to food or a sandwich. And you can add olives to pasta, pizza, and salad, or just eat the olives as a snack. You can use cream-based dressings on salads, vegetable pastas. You can dip bread in olive oil and vinegar. Sprinkle nuts, granola, or seeds into your yogurt, cereal. Use nuts, butters, and muffin and bread recipes. And you can add powdered milk to mashed potatoes, macaroni and cheese, and casseroles. You can add cheddar cheese to chili. Make an omelet using olive oil, lots of veggies and cheese. Add ripe avocado or coconut oil or ice cream to a fruit smoothie. Make trail mix with whole wheat cereal, nuts, raisins, and other dried fruit. You can use full fat milk instead of water to make your oatmeal or cream of wheat. And you can add powdered milk to a glass of fluid milk. You can sprinkle any kind of nut or seed on ice cream. Toss pasta with olive oil before adding your sauce. Use larger amounts of butter or trans fat-free margarine. Drizzle olive oil onto freshly popped popcorn. You can put cheese on your vegetables. And you can have chicken or tuna salad with extra mayonnaise. Now I'm going to talk about unplanned weight gain during treatment. the importance of stable weight during treatment, and ideas on how to maintain your weight and gradual fat loss if necessary. Weight gain can happen during cancer treatment for many reasons. Some cancers, such as breast, prostate, and ovarian, can cause weight gain. Hormone therapy or hormone changes and some types of chemotherapy or other targeted therapies may cause weight gain. Medicines can also cause weight gain as well. Being less active because you feel tired may also cause weight gain. You might also be eating more because you're more hungry. You could also be eating more because you are stressed. It's a way to cope with what's going on, or you're depressed. And you might have extra fluid in your body from the cancer or from the treatment. If you are interested in losing weight during treatment, talk to your care team first. It is usually recommended not to try to lose weight when you're having cancer treatments. However, for some patients, it may be helpful to slowly lose weight. Do not try to lose weight on your own when going through cancer treatment. If you're feeling depressed or need support, please contact your care team so they can help you. Please contact your care team as soon as possible if you notice sudden weight gain of 3 or more pounds in several days or within 1 to 2 weeks. If you feel dizzy or shortness of breath or confused, or if you notice swelling in your abdomen or stomach, arms, hands, legs, or feet. If weight gain occurs during treatment, or if you were overweight before treatment began, it is important to try to have your weight in a healthy range. Elevated weight with high body fat can cause other long-term issues like type 2 diabetes, joint or bone issues such as osteoarthritis, liver and gallbladder problems such as gallstones, high cholesterol, and high blood pressure can put you at risk for heart disease. Sleep problems such as sleep apnea, and recurrence or development of different cancer types. Okay, let's talk about some tips and ideas on how to help with weight loss after you finish treatment. First, don't skip meals. Smaller, more frequent meals can help to prevent overeating. Eat mindfully. This means to pay attention to your body when you are eating. When you feel like you've had enough to eat, stop. Quit before you feel full, stuffed, or sick from eating. You can have more if you're truly hungry. If you still feel hungry or unsatisfied after a meal or a snack, wait at least 10 minutes before you have more food. Often that craving will go away. Keep all of your food in the kitchen. Eat only in a chosen place, such as at the table. Don't eat in the car, the bedroom, or when you're watching TV. Have lean meats, low fat or non-fat cheese, and skim, which is non-fat milk or 1% fat milk, instead of higher fat, higher calorie choices. Drink plenty of calorie-free drinks, water, tea, coffee, diet soda. You may be thirsty instead of hungry. Get plenty of fiber. Vegetables, fruits, whole grains are all good sources. Have a high fiber cereal every day. Limit the amount of alcohol you're having, whether that's beer, wine, and liquor. All of these are very high in calories and can contribute to weight gain. Have less sugar. For example, drink less fruit juice and regular soda. Eat less candy and pastries. Stay active. Cardio activities like walking or any physical activity can help with controlling your appetite. Also, the more muscle you have, the more calories your body will burn at rest. So try to include some resistance or weight training in your daily routine. And of course, everything we do can be affected by how we feel. So get a little extra emotional support to help keep your mind in the game. You can also use the American Institute of Cancer Research's New American Plate as a guide for how your meals and snacks should look. It emphasizes choosing plant foods with plenty of fiber and nutrients that may help protect against cancer. The goal is to limit foods that increase the risk of cancer and helps us reach and maintain a healthy weight. The new American plate can be personalized to meet individualized preferences while making healthy choices for the proportion of different foods on your plate and for the portions you eat. The goal is to have vegetables, fruits, whole grains, and beans, and for that to make up 2/3 or more of each meal, and animal protein to make up 1/3 or less of your plate. Thank you so much, and that concludes this class.